So I think there are two different journeys going on. One is the journey to value-based payment, and the other is value-based care. So this value-based payment journey we've been on for about the past 10 years since the passage of the ACA. And I think most experts agree that we're not as far along as we expected or would have liked. But everyone knows that this is where the healthcare field is going, and no one is taking their foot off the gas. We're still working on getting there. It's just a challenging transition to go from fee for service to value-based payment. So we are still right in the middle of that transition. In terms of value-based care, I think it's really important to talk about how we're providing care to patients, because really that is the point of all of this value-based payment, to be able to provide the best care we possibly can to patients, to get the best outcomes, the best quality, the best patient experience, and at the lowest cost. So there are several challenges, but with them come some really exciting opportunities. So the first challenge is this shift in culture of mindset, where we need to just be thinking differently about how care can be provided and paid for. So a lot of providers, hospitals are pretty set in their ways of how they've traditionally provided care, and just shifting some of that payment to value might not really change behavior in the system. But I think this is an exciting time to be intentional about how we're changing care and really start bringing clinicians and administrators and patients together around what matters to them, so that we can provide care that is improving value-based care and value-based payment. I think another challenge that is really important to overcome is this idea that entering into value-based contracts is too much of an administrative and data burden, which really is just an opportunity for hospitals to think about how to invest differently in their infrastructure. So data analytics, incredibly important. But you don't just have to do one-offs with data analytics for value-based payments. What you build for one value-based payment contract can extend to the rest of them. So you're really just setting yourself up for success in the future. And last but not least, nobody has this all figured out yet. And you need to be open to playing around and tinkering and, figuring out what value-based strategies work for your patients and your communities.
So we know from experience that even for a patient who has a primary care physician at Ochsner, that about 45% of their total cost of care happens outside the Ochsner system. We know that by aggregating not only our EMR data, but also claims data from payers, which paints the large picture. By taking that data, combining it with admit discharge data from other hospitals in the community, lab data from freestanding facilities, and drug data, we can then see a holistic picture of the patient and identify opportunities for lowering cost of care and improving quality. So as a diabetic patient, for example, I may be seeing a primary care physician at Ochsner, but my nephrologist may very well be outside the Ochsner system. It doesn't always make sense, but it happens. And by collaborating with other providers across the ecosystem, we can see patients holistically, understand what's happening to them, and where their care might be falling short of keeping them optimally healthy. We try to do that at the point of care for patients so that providers can take care of patients in their own setting, but see information that's relevant to their performance in these value-based contracts.
The biggest thing that comes to mind is the role of stakeholder engagement in defining and prioritizing these use cases. So many objectives are going to be the same across most health systems because everyone wants to improve the quality of care, reduce costs, drive patient outcomes, and work on patient and provider satisfaction. So the real question becomes, what's the initiative that's going to make the greatest difference for your organization based on where you're coming from? For some groups, that's going to mean that you're already in a good shape on your quality measure performance, but you need to focus on understanding your cost drivers. Another health system might slice that differently and say that their employed physicians are killing it, but they have to focus on engaging their affiliates in a really structured and constructive manner. So if you're focusing on building out a data asset for advanced analytics, you have to think about having the right skill sets in-house for working with that data, which means both technical skills and healthcare expertise. If you're rolling out tools to a broad provider network, you have to keep in mind that provider offices need staff to support those workflows, and someone has to train them and support them and monitor adoption. I think one of the hardest things for organizations tends to be pulling this data together and normalizing it. So it's very common for us to see organizations that can produce one report for one population and another report for another population and yet another report for a third contract. And that puts their practices and their leaders in the position of getting sometimes dozens of reports a month, which can really lead to dashboard fatigue. No one wants to go to 10 different places to find out the 33 different things that they should be doing differently. And one of the key areas where we want to help is pulling that data together and telling a cohesive story that says, here are the 2 or 3 things that you need to work on. Here's that one thing that's going to make the biggest difference and really tip the scales in terms of your performance.